Oral care for long-term care residents. Hi, everybody. I am Chunde Huang, Professor Emeritus of Kaohsiung Medical University. Today, we will show you the oral care for long-term care recipients. Before we start, we have to check their physical condition. Before we check the physical condition, we have to check their consciousness, communication, and physical levels. So, we measure their vital signs. First, we check their ear temperature. Next, we check their blood pressure. After checking their blood pressure, we check their blood oxygen saturation and pulse. After we check their vital signs and physical examination is within the normal limit, we start oral care for the long-term care resident only when the resident is in a physically acceptable state. By doing so, we will know the physical condition of the long-term care resident. If they have a fever, elevated blood pressure, or decreased blood oxygen saturation to unacceptable levels, we have to send them to hospital immediately or refer them to physicians or consult the physician. 1. Elderly people can handle oral care by themselves. To remove dental plaque and food debris from the mouth completely, they need proper tools for teeth cleaning and a proper method. Basically, they have to use a toothbrush to brush the remaining teeth, and they can use toothpaste containing fluoride. The fluoride concentration should be more than 1,350 ppm. In choosing a toothbrush, the small brushes with soft bristles will be the best choice. For adults, we recommend to use the modified Bass brushing method. The key point of the modified Bass brushing method is to clean the spaces between the teeth and gum tissue in order to decrease the deposits of dental plaque. We recommend to hold the stem of the toothbrush in the same way you hold a pen. Don't brush your teeth too hard, as if you are making up for your teeth. If you brush your teeth too hard, it may harm your teeth and your gum tissue. If you use your toothbrush in a normal way, you should change it every 3 months. If the bristles are forked, or an elderly person is getting over the flu, you must change to a new toothbrush right away. The tooth is composed of 4 parts. They are the outer surface, inner surface, occlusal surface for biting foods, and proximal surface. At first, you brush the outer surface of the upper right posterior teeth. When you brush the teeth of the upper arch, use the modified Bass brushing method. Place the bristles slanting upward about 45 degrees on the junction between the teeth and gum tissue. Brush 2 teeth at a time. Move the toothbrush lightly and brush your teeth backward and forward 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Brush 10 times. Now, brush your teeth up and down another 5 times. 1, 2, 3, 4, 5. Now move on to the next tooth and brush the 2 teeth back and forth 10 times to clean the gum margin area. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now brush from up to down another 5 times. 1, 2, 3, 4, 5. Move on to the next 2 teeth. Brush back and forth another 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, brush up and down another 5 times. 1, 2, 3, 4, 5. When brushing the front incisors, you must turn the brush handle to the other side. Brush 2 teeth backward and forward 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Brush up and down another 5 times. 1, 2, 3, 4, 5. Move to the next tooth and brush 2 teeth back and forth another 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Brush up and down another 5 times. 1, 2, 3, 4, 5. Now, brush the outer surface of the upper left back teeth. Brush 2 teeth each time. Brush both teeth backward and forward 10 times. Then, brush from up to down another 5 times. After brushing the outer labial surface of the upper left back teeth, after brushing the outer labial side of the teeth, brush the inner lingual surface, and then turn to the gum sulcus of the inner surface of the teeth. Place the bristles slanting upward to face the gum sulcus. Brush 2 teeth at a time, back and forth for 10 times. Then, brush the teeth up and down for 5 times. When brushing the inner surface of the frontal and canine teeth, since there is a turning point and curve in the frontal and canine teeth, it's not easy to clean the inner side of the frontal teeth horizontally and difficult to clean it thoroughly. So, when brushing the inner surface of the frontal anterior teeth, we can hold the toothbrush vertically and clean 1 tooth at a time. After we brush the inner surface of the front anterior teeth, when brushing the upper left posterior teeth, we do it the same way, brushing 2 teeth each time, 10 times backward and forward. Brush the teeth up and down 5 times. After brushing the inner surface, we move to the grinding surface of the posterior teeth. Brush the grinding surface gently using the toothbrush. Brush 2 teeth at a time. Vibrate back and forth 10 times. Then, move to the next tooth. And repeat the same procedure. After brushing the grinding surface of the upper posterior teeth, we move on to the upper teeth and then the lower teeth. Just like the upper teeth, the lower teeth have gum sulcus too. When using the modified Bass brushing method to brush the lower teeth, you must place the bristles slanting and facing downwards. Place the bristles on the junction between the teeth and gum tissue with the bristles slanting downwards 45 degrees. Brush 2 teeth at a time. Gently move the toothbrush and brush your teeth back and forth 10 times. Then, brush from up to down another 5 times. Repeat the same procedure to clean the lower teeth. Lastly, don't forget to brush your tongue. You must brush your tongue from back to front. Brush the right side 1 time. Brush the left side 1 time. And brush the center 1 time. This is how we use the modified Bass brushing method to complete the oral cleaning process.